Top 6 foods to clean your arteries that can prevent a heart attack. Your arteries are the biggest veins in your body, and they are responsible for providing oxygen and nutrients to every organ, tissue, and cell. To suggest that keeping these essential channels in excellent condition is important for your health is an understatement. However, millions of Americans suffer from clogged arteries. They have atherosclerosis, which is an inflammatory disorder in which plaques, fatty deposits made of cholesterol and other chemicals, form inside arteries, interfering with normal blood flow and potentially leading to heart disease, heart attacks, and stroke. According to some estimates, atherosclerosis is the root cause of 50% of deaths in Westernized societies, and it is the leading cause of strokes and Alzheimer's disease. The good news is that there is a lot you can do nutrition-wise to reduce your risk of atherosclerosis and even reverse existing plaque buildup. So what exactly causes plaque development in arteries? A widespread myth concerning arterial plaque, atherosclerosis, is that it is primarily caused by high LDL cholesterol levels. But as Dr. Ford Brewer, MD, MPS, a board-certified preventative and occupational health expert points out, this is just one small aspect of the story. So who is the main culprit? According to Dr. Brewer, insulin resistance, having prediabetes or diabetes, is the most common cause of atherosclerosis, and so heart attack and stroke, renal disease, blindness, and so on. LDL matters, but only in a small way. Insulin resistance is usually caused by a high-sugar, high-carb diet or having too much body fat, he says. According to the Centers for Disease Control and Prevention, around 1/3 of all Americans have insulin resistance, a disease in which cells in your muscles, fat, and liver do not respond effectively to insulin and cannot efficiently absorb glucose or sugar from your blood. This in turn raises insulin and glucose levels in the circulation, causing widespread inflammation and potentially damaging the artery lining over time. The damage weakens the arterial lining, making it simpler for cholesterol molecules to enter through the artery wall. This cholesterol forms plaque inside the artery, narrowing the opening. Not only does this decrease blood flow, but plaque accumulation in arteries causes your body to release immune cells that fight the plaque, making it less stable, adds Dr. Brewer. This unstable liquid plaque can then shoot into the artery, forming a clot, and as we all know, clots can lead to significant heart issues including stroke. How dietary adjustments can help prevent atherosclerosis. As previously stated, the major causes of insulin resistance, and hence atherosclerosis, are a high sugar or high carbohydrate diet, as well as being overweight or obese. What's the good news? These risk factors, as well as increased LDL cholesterol, can be addressed with conscious dietary changes. Eating a diet rich in anti-inflammatory, antioxidant-rich foods, limiting sugar, and substituting healthy grains like quinoa for refined grains like bread is a good idea in general. This manner of eating is great for maintaining balanced blood sugar and preventing insulin resistance, and it has been found to minimize the risk of atherosclerosis and heart disease. Just keep in mind that whole grains may be a large source of carbohydrates, so combine them with healthy fat or protein to reduce blood sugar changes. If you have a glucometer, you may test your blood glucose levels after eating to identify which grains, if any, you tolerate best. Feeling extra motivated? Eat more of the foods listed in this video, which have been studied for their cardiovascular advantages and may help naturally unclog arteries by promoting blood sugar balance, losing weight, reducing inflammation, and lowering LDL cholesterol. Here are 6 artery-cleaning foods and why they are beneficial. 1. Fatty fish. Fatty fish, such as salmon, sardines, anchovies, and mackerel, are high in omega-3 fats, which are anti-inflammatory unsaturated fats that protect against vascular inflammation and atherosclerosis. Omega-3 fatty acids can also minimize platelet aggregation, thus decreasing the risk of blood clots, lower triglyceride levels, and increase levels of good HDL cholesterol, which helps to offset the plaque-depositing effects of bad LDL cholesterol. Furthermore, studies demonstrate that persons who consume 2 or more servings of fish each week are less likely to develop carotid artery atherosclerosis. 2. Flax seeds. Flax seeds also include anti-inflammatory plant-based omega-3s, alpha-linolenic acid, fiber, and antioxidant plant chemicals known as lignans. Regular flaxseed consumption has been linked to lower blood sugar and insulin levels, as well as better insulin sensitivity in overweight and obese people with prediabetes. Furthermore, preliminary animal studies show that frequent flax eating might help slow the growth of atherosclerotic plaques. Keep in mind that whole flax seeds aren't completely broken down during digestion, so choose ground flax seeds and keep them in the fridge to get the most out of them. 3. Extra virgin olive oil. Higher use of olive oil is linked to a lower risk of death and cardiovascular events such as heart attack and stroke. What distinguishes olive oil? It's high in monounsaturated fatty acids, MUFAs, and antioxidant polyphenols. Diets high in MUFAs have been linked to higher good HDL cholesterol and lower bad LDL cholesterol, while polyphenols and extra virgin olive oil assist in lowering inflammation, platelet aggregation, LDL oxidation, and blood pressure. According to one meta-analysis, persons who consumed the most olive oil had a 16% lower chance of acquiring type 2 diabetes and lower hemoglobin A1C, HbA1c, a measure of average blood glucose over several months. 4. Legumes. If you frequently consume grain-based side dishes, consider substituting legumes, beans, peas, chickpeas, lentils. These are high in fiber, especially soluble fiber, which can help prevent atherosclerosis by decreasing LDL cholesterol. Even one serving of beans per day has been linked to a considerable reduction in LDL. Legumes have also been related to blood pressure decreases and chronic inflammation, both of which contribute to atherosclerosis and blood vessel damage. Beans, according to the American Diabetes Association, have a low glycemic index, which indicates they are unlikely to cause blood sugar spikes despite containing some carbs. However, Dr. Brewer advises that beans may cause blood sugar to rise in certain people. He recommends many of his patients to eat to the meter, glucose meter, especially when it comes to lentils, which can be particularly problematic for prediabetics. Combining beans with a source of fat and/or protein can help to reduce blood sugar spikes. 5. Spices. Flavorful herbs and spices are typically effective sources of healthy substances that can assist the heart and arteries, including cinnamon, which you probably already have in your cupboard. Cinnamon consumption may be connected with lower HbA1c and blood pressure levels in type 2 diabetic patients, according to research. In other words, this spice may assist to counteract the unfavorable consequences of insulin resistance, which lead to atherosclerosis. Cinnamaldehyde, an organic molecule in cinnamon, has also been demonstrated to have anticoagulant qualities that may help reduce the danger of blood clots. An early study shows that cinnamon suppresses the atherosclerosis process in animals with high cholesterol. Ginger, turmeric, and garlic are among other spices that show promise in reducing certain atherosclerosis risk factors. 6. Green tea. You may also sip your way to clear, healthy arteries. In one meta-analysis, researchers determined that each daily cup of green tea correlated to a 5% decreased risk of mortality from cardiovascular disease. In another study, green tea drinking was linked to a drop in vascular cell adhesion molecules, which are proteins generated in response to inflammation that cause cells to attach to their environment and each other, meaning they can be a major contributor to blocked arteries. Green tea's polyphenol components known as catechins have potent antioxidant and anti-inflammatory properties. Well, there you have it, top 6 foods to clean your arteries that can prevent a heart attack. Hope the video helped. Thanks for watching.